Thank you very much for a kind introduction. Hi, everyone. Good afternoon. I would like to convey my highest gratitude to the ILSI global entities, especially the ILSI Southeast Asia, for having us here to share on our work. I am working on nutrition in diabetes, and what I would like to present here is about the challenges as well as what we have been going about to identify the best model. My name is Barakatun Nisak Binti Yusof. I'm an associate professor from the Department of Nutrition and Dietetics, Faculty of Medicine and Health Sciences, Universiti Putra, Malaysia. So this is where my university is all about. It is used to be known as an agriculture university. So who has been in Malaysia is about 30 kilometers from Kuala Lumpur, the city center, and about 10 kilometers from the Putrajaya, the center of administration, kind of your Washington, D.C., United States. Right, let me start the presentation with what are the challenges that we experienced back then. Recent data shows that our prevalence of diabetes has been increasing tremendously. And surprisingly, the current prevalence was relatively higher than the global prevalence. We're also experiencing the highest number of people who are overweight and obese among Southeast Asia countries. For those people with diabetes, their nutritional status are unmet. About 60 to 80% of the patients who are diagnosed with diabetes are either overweight and obese. In my clinic, for example, majority of our patients did not comply with dietary advice as well as exercise prescription. And therefore, majority of them had higher glucose control. And surprisingly, if you see in the slide, we had the highest postprandial blood glucose after meal among the Southeast Asia. Therefore, what I would like to focus here is our research that are integrating the fundamental as well as the applied research to identify the best model of nutrition therapy with the ultimate goal to improve the diabetes-related outcome as well as the quality of life. I have been working with individuals with type 2 diabetes as well as we just started a work among women with gestational diabetes mellitus. This slide to show the summary of my work. I have been involved to identify the gut health status that we compare between type 2 diabetes individual and lean healthy individual. And of course, as other data, we found there is a differences in the gut health status. And it's lead to the functional food application where we use the probiotics as well as the prebiotic kind of medicinal plant that known in our country as king of salad. And we found that there is some improvement in the metabolic control, especially the insulin level. I also involved in nutrition delivery research as well as nutrition education. But what I would like to highlight here is my research on nutrition delivery, where we start on identifying the rice-based diet that can induce diabetes in rats model. In that study, we compare the rice-based diet with the high-fat corn-based diet that commonly consumed by the Western population. And we found that the rice-based diet induced diabetes significantly as compared to the other test control diet. And this research has been bring me forward to perform my postdoctoral training in Joslin Diabetes Center, Harvard Medical School. And most of the research that we have been done in nutrition and diabetes has recently published in one of the journals. So when I did my fellowship, we identified what are the best nutrition delivery model. And we found that the structured nutrition therapy using a meal replacement with diabetes-specific formula that incorporate the low glycemic index diet have been shown to improve the blood glucose level as well as CVD risk factor among those overweight and obese with type 2 diabetes mellitus. And I believe attending this conference really an eye-opener to identify what are the novel food that perhaps we can use back then as an adjuvant therapy for my patient with type 2 diabetes. Ladies and gentlemen, what's next? The feasibility clinical trial is in the pipeline. We work with the industry to identify the best model trans-cultured to our population that can be sustained among patients with type 2 diabetes. And of course, we include the component of structured nutrition therapy, meal replacement, with the incorporation of low GI meal. My team and I was recently secured a grant to identify the nutritional risk, dietary pattern with the use of metabolomic to prevent type 2 diabetes among women with previous GDM, because we know that prevention is always better than cure. And I believe this approach is in line with the ILSI International, ILSI Southeast Asia region commitment to bring the cutting-edge science for public health impact. I am nobody without the support of my team. I would like to thank my mentors, various individuals who have made my journey in this area possible. Not to forget, of course, the UPM, the staff, my postgraduate students, collaborators, grant funder, ILSI Southeast Asia region, and not to forget our patients who have made the journey of diabetes nutrition now become visible and significant. With that, thank you very much.